stain which is used for staining fungal elements is methenamine, specifically Gomori methenamine silver stain. Dye which is most suitable for fungus demonstration in biopsies is PAS. It is periodic acid shift. Dermatophyte infection is superficial, and remember it is at the level of stratum corneum, not deeper than that. Coming to the tinea capitis topic, it is the most high yielding topic because many questions were asked from this one particular topic. In the question, the pointers to the diagnosis of tinea capitis are boggy swelling, multiple discharging sinuses, there will be cervical lymphadenopathy, and easily pluckable hair. These are all the pointers by which you can diagnose it as tinea capitis. And black dot variant is also called endothrix, is caused by trichophyton tonsilans and trichophyton violation. And these are rules like microsporum will not involve nail, epidermophyton will not involve hair. Epidermophyton will not involve hair, that we know, but trichophyton, it will involve all the three structures, nail, hair and skin, but among these concentricum is the one which does not cause tinea capitis. And you remember this is an important question, trichophyton concentricum causes tinea imbricata. Chirion and favors are inflammatory variants of tinea capitis which are associated with cicatricial alopecia. The points for the favors is cutula formation is seen, it is because caused by trichophyton schondlini. And coming to most common organism causing tinea capitis, I have seen that few books have given wrong information regarding this. I can't name the books, but you make it a point that in Southeast Asian countries like along with India, the most common cause is trichophyton violation, whereas in America it is trichophyton tonsilans, whereas in European countries the most common cause is Microsporum canis. And this is another rule, all tinnias are most commonly caused by trichophyton rubrum except for tinea capitis. I have already told what are the most common causes for tinea capitis. Most appropriate line of treatment for tinea capitis is oral griseofulvin irrespective of the what is the causative agent. But if specifically trichophyton is given, then the answer will be terbinafine. Otherwise, it is oral griseofulvin. And remember, griseofulvin is always oral formulation. Topical is not available. Duration of treatment is 6 weeks. Griseofulvin can be used apart from tinea capitis for tinea corporis and tinea unguum. Tinea unguum is also called as onychomycosis. But griseofulvin is not useful for tinea versicolor and candidiasis. In treatment of tinea cruris, for which drug widespread resistance is developing since last 2 years? This was the question recently asked. The answer for this is terbinafine. This was a AIIMS question. The answer for this is terbinafine. And best diagnostic test for fungal skin infection is potassium hydroxide mount, that is KOH mount. Tinea unguum, also called as onychomycosis, affects nail plate. I have seen that options mention nail fold, nail bed, but you remember that it is nail plate, that is nail proper. Drug of choice for onychomycosis is terbinafine because it has very high penetration levels into the highly keratinized nail. And also remember, griseofulvin is not useful for tinea unguum. Sorry guys, I wanted to say that griseofulvin is not the drug of choice for tinea unguum. Griseofulvin can be used for tinea unguum, but remember terbinafine is the drug of choice for the onychomycosis. Tinea incognito is seen with steroid treatment. Remember, always anytime incognito is given, it literally means that not cognizable. That means we cannot understand what the disease is because of the steroid abuse. There will be clinically no clue by which we can make a proper diagnosis, because steroid has modified the already involved pathogenesis or whatever may be the condition. If it is related to tinea cruris, then we'll call it as tinea incognita. Treatment of tinea unguum is itraconazole, terbinafine, which are commonly employed. Even topical preparations are there like cyclopyroxolamine and amorolfine. Cyclopyroxolamine is used in dermatophytosis. And coming to tinea versicolor, the drugs which are effective are ketoconazole, selenium sulfide, and clotrimazole. In tinea versicolor, we can find spaghetti meatball appearance on KOH mode. This can also be given as banana and grapes appearance. And in T versicolor, on wood slab examination, you can find fluorescence. That is seen because of the pteridine which is present in the T versicolor. And few points about the other antifungal agents which are available. IV formulation caspofungin, topical undicyclinic acid. Thobisage, tinea cruris is called thobisage. And few points about athlete's foot or tinea pedis. Fourth web space is the commonly involved one associated with severe itching. And as I already told, the common most common tinea in all forms is tinea rubrum except for tinea capitis. And it is usually associated with increased sweating or hyperhidrosis. Coming to candidiasis, many a times not one-liners but few case scenarios were given for candidiasis. Like commonest fungal infection of female genitalia, if she is diabetic, the answer is candidiasis. A washerman came with thickness, erosion and discoloration of web spaces of the toes, then the answer is candidiasis. Then an apparently healthy male presents with a creamy curd like white patch on the tongue. The probable diagnosis is candidiasis, and we should send the patient for investigation for the blood sugar level because he is just apparently normal. Maybe he is having clinically undiagnosed diabetes. And in candidiasis, always we will see a white patch in the oral cavity, but exception is chronic atrophic candidiasis. It's not associated with white patch. And mind you, candidiasis is not a sexually transmitted disease. So partner management, that is management of male, is not done. And coming to the topic of sporotrichosis, it follow in the clear case they will give you, usually there is a history of a person who is living in Himachal Pradesh came with a thorn prick followed by a linear nodules appearance over the lower limb, or it can be also upper limb. The linearity is because the infection follows lymphatics. Here the treatment is potassium iodide and in biopsy you can find asteroid bodies. And as we have discussed in Hansen's disease, satellite lesions are seen in three conditions: BSC, BT Hansen's, sporotrichosis and candidiasis. If you have not yet watched my Hansen's disease video, I'll put it in the link in the I button above. You can watch it. Chromoblastomycosis is another deep mycosis. The case in the question they will give a person presenting with cauliflower like lesion on the feet with microscopy showing copper penny bodies, sclerotic bodies or medullary bodies. Then the answer will be chromoblastomycosis. And Welch regimen is used in actinomycetoma. Even modified Welch is also used in actinomycetoma. Remember, in eumycetoma, which is a proper form of deep fungal infection, it is antifungals which are used, whereas in Welch regimen we will use antibiotics. Okay, that if you like this video, please do give it a thumbs up and support. Thank you for watching my